Master the ABCDE Assessment, the Essential First Aid Protocol. In this video, we'll teach you how to master the ABCDE approach, the systematic, gold standard used by healthcare professionals to assess and treat critically ill or injured patients. Learn the key steps to identify life-threatening conditions, prioritize care, and respond effectively in emergency situations. Let's get started and improve your life-saving skills today.
Start by observing the patient for a few seconds and seeing what you can gather. Then you want to introduce yourself to the patient. Tell them your name and your level of training. Next, ask for permission for you to help them. If you ask a coherent adult for permission to treat and they say no, do not provide care. If the patient is unconscious or unable to make decisions for themselves, then you should assume they would give consent for care. While you are talking to the patient, you are also observing the patient. In a moment, we will talk about the way we want to start that observation. When we approach a patient in the field, we take a step-by-step approach to make sure we don't miss anything. The first thing we do is called a primary assessment. When we're doing the primary assessment, we're going to make sure that we address any life-threatening conditions as we find them. By this we mean that if you find a problem that is life-threatening during the primary assessment, you should stop, fix the problem before you move on to the next step. Primary assessment can be remembered easily through the acronym A, B, C, D, and E. A stands for airway. In this instance, you will evaluate the patient's airway by verifying they are able to get air in and out of their nose and mouth and down to their lungs. Ask yourself, is the patient talking to you? If so, then the airway is intact and you can move on to the next step. Remember our skier that was down in the snow? We want to evaluate his airway. Can you see, is his airway packed with snow? Did he bite his tongue and is there blood in his mouth? Does he have any broken or missing teeth? If the patient is not talking to you and it appears that the airway is not intact, you should check to see if they're still breathing. Here's how to do that. When you look, can you see their chest moving up and down? Get close enough to listen to see if you can hear or feel their breath. If the answer to these questions is yes, then the airway is working. If the answer is no, then you can try repositioning the airway by doing a head tilt or jaw thrust maneuver. There will be a skills video in this course demonstrating the jaw thrust maneuver. Let's continue learning about the acronym ABCDE. If the patient is speaking, breathing is okay. If they're not breathing, you can try first repositioning the airway. If the airway is open and the patient is not breathing, consider giving rescue breaths. Rescue breaths are where you put your mouth over the patient's mouth and blow air into their lungs. Please watch the skills video that demonstrates how to perform a head or chin tilt jaw thrust and rescue breath. C stands for circulation or the flow of blood throughout the body. You will want to look for any major bleeding coming from the patient. Also, you will want to make sure the patient has a pulse. It can be easy to miss major bleeding, so make sure you're looking inside their clothing and underneath them for any evidence of bleeding. If you find a patient bleeding heavily, the first thing will be to stop and apply direct pressure to the wound. In a later video, we will teach you wound care. Now we will move on as if the patient does not have significant bleeding. Now let's talk about D, which stands for disability. Do you see obvious deformities that could lead to permanent damage? The most common thing we're looking for is a spinal injury. If there is concern for a spinal injury, you will need to stop and assess. Is the patient moving or able to move all of their arms and legs? Can they feel their arms and legs? These are things we evaluate when we're worried about a spinal injury. In wilderness medicine, the last letter, E, stands for environment. When you're taking care of patients in the wilderness, the environment is important for both you and for the patient. If it's cold and your patient is on the ground, you will want to try and get them off the ground into a warmer place. If you're out in the hot sun, you can try and get them into the shade. If it's wet, can you move them to a drier location? E can also stand for exposure, meaning that we need to make sure we expose or see all of the patient's injuries. Let's take a break now and watch the demonstration videos on chin tilt and jaw thrust, rescue breathing, finding the radial and carotid pulse, and applying direct pressure to a bleeding wound.
Get your copy of the Wilderness First Aid Guide now. Be prepared for anything the wild throws your way with this essential survival guide. Don't wait. Secure your copy today. Link in the comments below.